start with a quote taken from the final report of the executive summary of AVMA's One Health Initiative Task Force from 2007. And that is, and I quote, "The convergence of people, animals, and our environment has created a new dynamic in which the health of each of these three groups is inextricably interconnected." This statement truly highlights the importance of One Health that Dr. Clifford was speaking about, and how our increasing interdependence with animals emphasizes that critical role that veterinarians have in playing in protecting public health in many areas. As you heard, approximately 3 out of 4 of new human emerging infectious diseases are zoonotic in nature. And again, that means that they originate in animals. And just to start with the basics, infectious diseases, of course, are caused by what are called pathogens, which are organisms that cause the infection, specifically viruses, bacteria, fungi, protozoan organisms, or parasites, aberrant proteins known as prions. And emerging infectious diseases are infectious diseases whose incidence, when you think about what is an emerging infectious disease, they're diseases that have increased in incidence in the past 20 years and really threaten to increase in the near future. So I can give you 2 very quick common examples from recent history. One is certainly from November 2002 to July 2003. As you may remember, severe acute respiratory syndrome known as SARS infected 8,422 people with 916 deaths and a fatality rate of 10.9%. This coronavirus was hosted by a wild animal called a palm civet, mutated and allowed it to cross-infect across other species, in this case from palm civets to humans, and then from humans to humans. Within weeks, SARS had spread from Hong Kong to infect individuals in 37 countries. Another example would be the human immunodeficiency virus, or HIV. HIV is a retrovirus, believed to have originated in West Central Africa, where it mutated and jumped species from non-human primates to humans. Emerging infectious diseases can result from a number of mechanisms. One is from the evolution of existing organisms, like influenza viruses that we heard about. These viruses tend to mutate pretty readily, and they're the reason that we need a new flu vaccine developed every year. Influenza viruses cause concern about migratory birds or poultry, possibly carrying H5N1, known as bird flu or avian influenza, that can mutate at any time to affect people along migratory pathways. These EIDs, emerging infectious diseases, occur when a known infection spreads, for example, to a new geographic area or population, such as when West Nile virus developed in 1999, when Dr. Tracy McNamara, a veterinary pathologist, formerly at the Bronx Zoo, was the first person to determine that zoo animals and wild birds were indeed dying from the same disease that was infecting people in New York. Lyme disease is another example of a newly emerging disease in areas undergoing ecologic transformation, which we see all the time, where rural areas are now developing into suburban ones, where humans are more closely in contact with wildlife species and their parasites and their infections. So again, 3 out of 4 of these emerging infectious diseases originate in animals or are zoonotic. And veterinarians are key health professionals in those surveillance and the management of those diseases. Veterinarians serve as epidemiologists in city, county, state, and federal agencies, which we've heard a lot about already, investigating animal and human disease outbreaks, such as foodborne illnesses. And veterinarians help to ensure the safety of food processing plants, restaurants, water supplies, and we evaluate the safety and efficacy of medicines, medical products, and food additives. And in fact, when I was in veterinary medical school, I was pretty surprised that I spent a good deal, part of my time, at slaughterhouses or at restaurants or food distribution centers as part of our education. Now, however, I'll put on my small animal hat because that's what I do in my real life and have done for the last 34 years. Many of us have pets. The human-animal bond is getting stronger and stronger and stronger. We've come to understand what veterinarians do and who they are through our relationship with our pets and where we see veterinarians most commonly. Every patient that I see in small animal practice has the potential to be a health hazard for its owners, depending on the right circumstances, of course. There's many examples. First of all, rabies. From rabies exposure of pets to skunks and bats, where I live in Wisconsin, or on the case of the eastern United States, raccoons is a very common reservoir. Secondly, cat scratch fever, a bacterial infection that comes from cat bites and cat scratches. Larval migrans, which is an exposure to roundworm and hookworm infections in cats and dogs, or from wild raccoons in our urban areas. Diarrhea, a lovely subject for lunch, from salmonella infections in pets, especially in reptiles, iguanas, turtles, and most recently, I'm sure you've heard about the salmonella infections that was from human contamination of pet foods that people were handling for their pets. Psittacosis pneumonia comes from infected pet birds. Leptospirosis is from pets exposed to water contamination by infected rodent, deer, or cattle urine, which we see a lot of in Wisconsin. Toxoplasmosis, I'm sure you've heard about. You shouldn't be handling cat feces, especially if at the time you have a pregnancy in the family. Hydata disease, a human form of parasitic infection caused by small tapeworms that live in dogs and foxes. Ringworm infections caused from pets, commonly seen in cats from catteries or dogs of various origins, certainly very common on cattle farms. And skin rashes from a variety of mange mites that we see in our pet populations. So small animal clinicians also receive questions in addition to on all of these human health concerns. I get questions routinely, especially in Wisconsin during hunting season, on chronic wasting disease, on ehrlichiosis carried by ticks when they're handling the deer carcasses after hunting season. BSE infections, most recently, of course, with the diagnosis of a cow in California, and even listeriosis in cantaloupe. I get that. We communicate daily with families, and their most important concern, their most important question when I see one of their animals with a skin infection or an illness, a fever of any kind, you know what their number one question is. Can anyone guess what their number one question is? Can my kids get this? Can I get this? That's their number one question. Public health, family safety. And always on our minds when we discuss during our physical examinations and our consultations are the owner populations that include small children, elderly, those whose immune systems are compromised because of HIV infection, chronic illness, chemotherapy treatments, and transplant patients. I would love to know what the percentage of our population is that fits in those categories. Small children, elderly, chronic illness, chemotherapy, HIV, transplant patients. And a lot of this you never know when they come to the hospital with you. You don't know all of these personal situations in their families. We have to deal with that every time we see either a healthy animal or especially if we see one that is not healthy for some reason, whether that's a contagious disease. Monkeypox is a perfect example, something we've never seen before. We always tell people, all of our veterinary students and veterinarians in general, diagnosis is the key. You have to know what's going on. If you don't know what's going on, you biopsy it. You never know when you're going to see something for the first time, whether in large animal practice or in small animal practice. We have to know what's going on so that we can protect people, especially those categories that are higher risk. So our shrinking world has indeed propelled us into a different way of thinking, toward a philosophy of one health, where human and animal and environmental issues truthfully intersect. Veterinarians are not only pet doctors, as many of us assume, and no matter where we work, we are uniquely qualified to lead those efforts in protecting human, animal, and environmental health in a variety of species in an ever-shrinking world where transportation and travel is quickly done around the world, and with the stresses that we're going to encounter with an ever-increasing population, which I'm sure we'll hear more about as far as food security, food safety, and a number of other issues. So I really appreciate the opportunity for you to understand the diversity and complexity of this profession and the roles that we do play in protecting public health. Thank you.